Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, or butts. I've been asked to do a video on buccal fat reduction, okay? So this is something I've been doing for, unfortunately, it means I'm old, but I've been doing it for about 40 years, and I've done hundreds and hundreds and hundreds of cases. And there are so many myths and falsehoods about buccal fat reduction, largely due to social media, okay? And I want to debunk some of those, and I'm going to show you a really small little lecture about buccal fat, and then I'm going to show you videos of me removing buccal fat or reducing it in 2 different methods. So hope you enjoy this. First of all, it's not buccal fat removal because we don't remove the entire buccal fat pad. That fat pad goes from up here in the temple all the way down to the cheek, all the way down to the jawline. And I saw somebody on the internet the other day saying they took the whole thing out. Tell me whoever would want thinner temples. I mean, you know, that's one reason we do fillers and things like that. So it's not practical, and it'd be very difficult, frankly, if not dangerous, to try and remove the whole buccal fat pad. So as I'll show you, there are 2 portions of the fat pad right in this area, the body and the extension, and that's what we're reducing. It's not buccal fat removal, it's buccal fat reduction, okay? So it's like eyelid surgery. We don't take out all the fat, we just take out just enough. And when you reduce buccal fat pad, where do you see it? I have patients come in and they're on social media and they say, oh, it's gonna thin my whole face, my cheeks and everything. That's not true. It is gonna affect this area right here. So if you go to the corner of the mouth and go over right about here, that's where your buccal fat pads are when they're full. And if you suck in just a little bit, like that, that can give you an idea what you may look like after buccal fat reduction. Now, the whole thing about how you're going to look after the procedure depends how much buccal fat that you have. There are some people that have really big buccal fat pads the size of a ping pong ball. And there are other people that just don't have much fat there. So obviously the more fat you have and the more fat that you reduce, the more result you're going to see. Okay? And another thing that I see a lot is people say, oh, don't take out or reduce buccal fat because in 20 years you're going to look skeletonized. You know, that's just not true. If you do that procedure correctly, and I already told you, I've been doing it for about 40 years, I have yet to see a patient that I did years ago that looks skeletonized. So, you know, as cosmetic surgeons, I don't care if it's eyelid surgery, liposuction, abdominoplasty, whatever, you have to know how much to remove, okay, and when to stop. Now, there are structures in there, the parotid duct, the buccal branch of the facial nerve, so you have to know what you're doing, but it's a very simple procedure. And we're going to go through a little talk here, and then I will show you some actual footage of buccal fat reduction, and hopefully we will quench some of these myths. But again, because of social media, it's just becoming so popular, and it's not an answer for everybody, but we do it a lot to slim the face, whether we're doing it by itself, or I do a lot of my facelift patients, and I do over 100 a year, get buccal fat reduction. So stick around, we're gonna show you some more stuff.
So when reducing the buccal fat pad, there are 2 incisions that I use. This is the Stenson's duct, the parotid duct, and you can make an incision just under this, which I used to do as my primary incision. But if I was unable to retrieve the fat through that, then I would make an incision up here in the sulcus area, and that's what we're going to do today. So we're going to make an incision just through the mucosa, just lateral to the 2nd molar tooth. And we're going to take a tonsil clamp and spread and just kind of poke through and spread. And usually it's pretty easy to access the buccal fat through this. Now, if you're having trouble, you can take a suction, put it in there, okay? And there it is. And honestly, I think that this is probably, hold that. I think that this is probably the easiest way to retrieve this fat pad. Hold that. Somebody hold this. And you just gently pull. And what I like to do is use 2 instruments. And what I'll do is to put traction on it with one and just kind of wiggle it out of there. And as it starts to come out, re-grasp it, spread, and the buccal fat pad is a large structure that runs, put your retractor up higher, Sally. It's a very large structure that runs from the temple to the mandibular angle, so you're not, I hear people say they're removing the buccal fat pad. Well, they're not. They're reducing it, for one thing. And the end point is going to be when you don't have any more fat coming, or you can actually see a dimple on the patient's cheek if you look. So you can see that this is coming out quite nicely. And we usually take a picture for the patient. People that have buccal fat reduction, patients that have buccal fat reduction really like to see the fat that they have. All right, so let's just take a peek at this for a second. And this is kind of about the average that you see coming out. And then you get to a point where it kind of billows out at first. Then you're going to get to a point where really there is no more what I would call easy fat, free fat, billowing fat. And you get a little stalk there. And what we want to do is take a bipolar forceps, so you have a bloodless situation, and come out. All right. And generally, and of course we put local anesthesia in this, but generally you can see an indentation right here. Now this is really important because patients come in and they say, well, I want to reduce my cheeks, I want to define this whole area. The buccal fat pad is lateral to the corner of the mouth. So that's right there is where you're going to see the difference. We're going to put usually just a single foro gut suture here to close it, just to keep food out of that. So now we're going to do, on this patient, an alternate approach. This is the parotid duct, and we're going to make an incision just through the mucosa. I don't want a deep incision because I don't want muscle bleed. Now what I'm going to do here is I'm going to use this tonsil clamp, and I'm going to go posterior and superior. I'm poking through the buccinator. You don't want to pull on it too hard. And spreading, pulling, spreading, traction here. So you can see that either approach works well, but I've kind of started favoring the previous approach just because if I can't locate the fat pad here, which can happen sometimes, then I will go to the pterygoid approach, or that lateral vestibular approach that I just showed on previous video. And this is pretty typical, and again, you know, we like to take a picture, something like that, so the patient can see how much fat we removed. And then there just comes a point where you start getting resistance, but spreading is important because these are encapsulated, and sometimes you have to break up that capsule. And there's our fat pad. That's, you know, usually that's enough to fill a tablespoon in terms of the volume that we remove. Okay. I do have a little bit of bleeding here, and you don't want that. Let's blot in there a second. So, okay. And once I cauterize that, technically, I don't need to put a suture in there because that's constricted everything, all right, everybody out. And that buccinator holds the cheek against the teeth. So that's 2 ways to extract buccal fat. I'm Dr. Joe Niamtu. Love that face.
So I'm going to show you some before and after pictures. This is buccal fat we took out on the patient here, and you can see the difference. And it's very important to remember on all of these patients that buccal fat reduction is a very conservative procedure. The results are very subtle, and it's not a situation that's going to slim your entire face. It's going to be concentrated in the areas that I showed you across from the corner of the mouth. And you can kind of predict this by sucking in a little bit on your cheeks. But it's not something you're going to be disappointed if you think this is like a life-changing thing that's going to change all of your facial features. But I can say that people that do this are satisfied with the procedure and happy that they did it. But it's very important not to overpromise results and be honest with patients what to expect. But again, it's a quick little procedure. I think it's a fun procedure for surgeons, and I think patients enjoy the benefit, and it's become very popular with social media. But again, I was doing this many decades before social media was even around. So I enjoy doing this, and I am Dr. Joe Niamtu, lovethatface.com.